Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I am a general pediatrician and proud JOMA member. And today I am super honored and super excited to be here today with Dr. Shira Berkovits. So I have several things to add. First of all, as I always say, if you have any topic you're interested, comments on this episode or other episodes, you want to hear someone being interviewed, you want to be interviewed, please reach out to us at health, HEALTH, at joma.org. I have two things to say in addition. Number one, Dr. Shira Berkovits was a little ill with that virus that we shall not name at the time of this interview, and much to her credit, I'm very grateful to her for not canceling, because I waited 8 months for this interview. That's number one. I'm really grateful to her. And the other thing is the trigger warning that this is a sensitive topic. It is for mature audiences only, and it may be triggering for certain people, including victims, survivors of any kind of abuse. So Dr. Berkovits is president and CEO of Sacred Spaces, a behavioral psychologist with a research background in creating large-scale organizational change and an attorney specialized in criminal law. Shira has spent years studying the intersection of psychology and law as related to sexual offending in faith communities. Bringing a uniquely Jewish lens, Shira partners with Jewish leaders to build healthy and accountable institutions whose culture and daily operations foster sacredness and reduce the risk of harassment, abuse, and other forms of interpersonal harm. In her role as CEO of Sacred Spaces, she has worked with Jewish communities across 5 continents to prevent, handle, and heal from institutional abuse. In addition to an Amazon bestseller, Shira has published pioneering pieces on abusive institutional practices, which are regularly cited as foundational texts in the Jewish abuse prevention field. Selected as an inaugural Wexner Field Fellow and named to the Jewish Week's 2017 36 Under 36 for her pioneering work on abuse prevention, Shira sits on the board of the Academy on Violence and Abuse and is a member of the National Coalition to Prevent Child Sexual Abuse and Exploitation. She can be found at jewishsacredspaces.org, and we do mention 2 other organizations, ALEINU and Keilim, KEILIM, and those links are found on the Jewish Sacred Spaces. Thank you so much for joining me, Dr. Berkovits. Especially, I understand you're under the weather, so I really appreciate, after this wait, a long wait, to interview you, that you're still doing it with me.
It's such a pleasure to be here. Thank you for inviting me, and thanks for being in conversation.
Absolutely. Like I said, I've been waiting for a long time, and we all, I think, have changed profoundly since the Walder, issue. And I think we're much more aware of the problem of child sex abuse. I don't think that there is nearly as much, attempting to push it under the rug. And there's a lot more information for parents. And I feel like parents are feeling even more pressure that they have this all on their shoulders, but we have a communal responsibility to keep our kids safe. So your organization is so incredibly important. And I'd like to start with just telling us, what is Sacred Spaces?
So Sacred Spaces is a nonprofit that partners with Jewish institutions to prevent and respond to sexual abuse and other abuses of power. And essentially, it's the brainchild of a group of Jewish professionals who were really frustrated by seeing this kind of cycle of institutional abuse, cover-up, superficial reforms that were in response to media exposure, right? And so we kind of sat down and asked ourselves, what if we could do this differently? What if it looked differently? Could there be some sort of solution that could work across the Jewish community? And instead of this being a divisive issue, communities could come together with one unified goal, And how do we start to shift the culture around it, right? Because it's not just about technical changes, but if we have a long entrenched institutional culture, how could we shift it while empowering the Jewish organization themselves to feel like they can lead on this issue? And that led us to create sacred spaces. And our goal was really to just standardize abuse prevention and response across our Jewish communal organizations, so that there are really clear expectations. The public knows what to look for. Jewish organizations that want to do this work can access support and resources. And that's what we do.
So how does that work? What exactly is it that you do?
So we have three main program areas. We work across the lifespan. And in the beginning we were starting with children, and we thought, oh, we're going to prevent child abuse in Jewish institutions. And it became clear very quickly that the dynamics involved in abuse and how communities respond and how victims are treated, these dynamics are pretty similar across the lifespan. And so now today we have three core program areas. One is our Aleinu Safeguarding Youth program, which helps institutions through 10 best practices in youth safeguarding. Our Keilim policy toolkit, which works with Jewish workplaces to prevent harassment and discrimination in the workplace. And we are now launching into elder abuse work.
Excellent. Excellent. And that includes all institutional abuse, right? Like group homes.
Correct, exactly.
Which would that fall into? Say if you have kids who are not elders, but they're in a group home, which category would that fall into?
That's safeguarding youth.
Safeguarding youth. Okay, fine. Well, at some point they might be adults, but not elders. I'm thinking of developmentally disabled adults who are in between youth and elders. Where will they go? I'm just curious. I have a daughter in a group home, so this isn't a small question for me.
Well, and this is why, right? Like you really have to work across the lifespan, across different types of institutions. Right. Our work is across denominations as well, right? And so kind of looking how it manifests in different institutions is where the work is. And dependent adults have more vulnerabilities in certain areas, and right. And so you might have more safeguards in some ways. And so these are our sort of large programs. And then we would also work directly with institutions to provide services on the prevention end, which could be assessments. It could be work with boards of directors, as well as case consultations to respond when something comes up to support the organization in ethical case handling.
That is amazing. So that's a lot of different things that you do. It's really incredible. I read somewhere that there's a wait list, though, to get your services. Is that true?
It's true, yes. And it depends what it is that you want to do, right? So our programs, such as Aleinu or Keilim, these are accessible to all people. That the real goal is that wherever you are, whenever you need it, you should be able to access these resources. And so there's no wait list to join, and Keilim is open access completely. You don't have to join at all.
Right. Is that from your website? How do you spell that? I know Aleinu is Aleinu.
And Keilim is Keilim.
Like vessels.
Exactly, like sacred vessels, like Kli Kodesh. And so those are accessible. So any organization that says we want to do youth safeguarding work tomorrow, they can join Aleinu. There's no wait list for something like that.
Is that a separate website? I think I saw a separate website. This was sacredspaces.org, right? Or sacred.
So would you believe it? We have 3 websites. We are not
building.
Oh my
Lord.
Anymore. We have jewishsacredspaces.org is our website. Okay. Because the material on Aleinu or Keilim is so comprehensive and robust, and because we're providing real implementation tools, we're not just saying here are the standards. They just each needed their own platform to be able to support all of those resources. And so to give you an example, let's say with Aleinu, right, the standard youth serving organization today would know, oh yes, we have to interview people before we hire them. We need to do a background check, right? So that would be like the standard, right? But then how do you implement that? Are the people who are conducting the interviews, are they trained on what a red flag might look like? What a follow-up question should be? What do you do when you see something? And so one resource that we have is a simulated role play of an interview, and we'll have 3 versions of this: one of somebody who's concerning, one of somebody who's a strong candidate, one of someone who's inexperienced, and just really with facilitators guides and helping people to begin to apply the concepts that they've learned in practice, and to pause the video and to practice with each other. So really trying to just get those kind of things out there.
Absolutely. What were the other websites? Because it's jewishsacredspaces.org. I'm going to put all of these in the liner notes so people aren't, what did she say?
Yeah,
And click on it. Click.
Yes, so it's jewishsacredspaces.org, and you can obviously get to all of these websites from any one of them.
Okay, that's true.
It's like, Gap, Old Navy at the top. You could go from Aleinu to Keilim. It's Keilim.org, so KEILIM.org, and it's AleinuCampaign.org.
Wow. So the one that there's a wait list for is the school or institution-based preventative intensive programs?
It's if you want individual consulting services, right?
Individual consulting, I see, as opposed to the resources.
Or a cohort program, right? If you're saying, we want to work with you and we want to work with you for 6 months in an intensive
Right, more intensive, right.
Well, then we can't take on the 9,000 plus Jewish organizations tomorrow. And truthfully, it's not right for them either if we do, because what we find is that from the time that an organization says like, yes, I'm ready, I want to do this work tomorrow, actually, there's often some preliminary work to do to get ready for that so that you can set the initiative up for success.
Right, because there really is so much to this. I think that people don't realize how much they don't know.
Right.
Until you're in the middle of a situation and you start flipping your lid.
Right. So it's best if you could start to put some systems in place beforehand. It's infinitely easier when the time comes. It's never easy, but it's better if you could just sort of follow your protocol, right? And where everybody starts to go wrong is if they're either deviating from their protocol or they never had one to begin with. And then what happens, and it's a very normal human thing, is that we all go, look, I'm a really intelligent person and I'm against abuse. And I stand up for victims. And so obviously, if this ever occurred, I would know what to do. And the bottom line is that when it does occur, you don't know what to do. Sometimes that's because of various factors that get in the way, such as like cognitive dissonance, right? Like this is somebody we know, we love, we respect, and we know them to be doing good things. And so it's really hard to reconcile that with an allegation of doing something really awful. And sometimes we mess up because we're trying to do the right thing, but if we're not prepared, we don't realize that something that we thought was really good actually could be harmful. And so, an example of that might be saying to an individual who comes forward to disclose abuse, saying something like, okay, tell me what you want to see happen here. And you're asking the question because you want to center a victim's voice in the process, right? And you want to make sure that you're listening. But depending on how you ask that and at what stage and what process you've gone through, what you could also be communicating is the onus of responding is on you.
Right.
And depending on what you say is how we're going to do that. And then we'll often hear years later, like the organization didn't do anything and they turned to me who had just been harmed to do the response. So that's just an example, but this is why we need systems in place.
Right. And I would like to talk a little bit about what the barriers are here, because we're talking about institutions versus individuals. We're talking about power versus vulnerability. And we're also talking about a lot of abuse that you may not have physical evidence for.
Right. Well,
one person against an institution sometimes, or it could be.
Yes. Well, wouldn't it be wonderful if instead of viewing it as an individual against an institution, we viewed it as everybody's actually on the same side, right? It's in the institution's best interest to treat a disclosure of abuse as a gift, because that's really what it is. That's somebody saying, I trust you. I'm sharing this really difficult information, and I'm giving you an opportunity to support me and to protect, safeguard the community. And so getting that information, and in fact, the earlier we get it, the better, is a gift. And so if the institution goes into defensive mode of like, oh no, you're attacking our sacred community here, and this allegation is going to tear us down, that's one potential response. But what would happen if instead the institution receives this disclosure and says, okay, we're going to, we'll do our due diligence here. We're going to look into this in the proper way. We'll follow our protocols. And somebody here is telling us that they've been hurt. How do we support this person? And I think you just have very different outcomes depending which way you go.
Exactly true. And that's the ideal, but I want to go a little bit into, it's very basic to you and me, but I want to go a little bit into the actual issues here of the power
Sure.
differential just for a few minutes, just because this is what someone's up against, and also just maybe a little bit of who might be the most likely victims. In other words, they're not just an average person, they're often even more vulnerable and marginalized.
Yeah.
Just
Well,
for
I
a few
think,
minutes. You don't have to go really deep into this,
no,
but
I'm happy to talk about this.
I
So,
think it's important because I think that typically what happens is people take sides when they're not following your best practices.
let's address both of those points. So in terms of who can be abused, we have to sort of deal with two realities. The first is that any person can be mistreated or abused, and it's really important to say that, right? Because we don't want people to think that if someone's abused, it's because they did something, right? Like
Right.
anybody, it doesn't matter who you are. If they're, especially when you're talking about vulnerable people, so anybody who's not in a position of power, right? The person in a position of power decides that they're going to abuse another person, they can abuse another person, right? They have the power to do so. And we also know that certain individuals, particularly those who are socially marginalized, are more vulnerable to mistreatment and abuse than others. And then when those people come forward and say, I've been abused, they're less likely to be believed because they're marginalized, right? And so that is true. And then just generally, when we're dealing with institutions, we're dealing with there are great power dynamics when you're dealing with a clergy person or somebody who's in a position of leadership, right? To come out against somebody like that and say, this person abused me, people before they ever disclose understand inherently that this is going to be an uphill battle.
Right.
And to come forward requires enormous courage. And there are a lot of people watching from the sidelines, right? So we know the prevalence of abuse, and we
Hmm.
know that this is occurring. But if you look at
I'm
how
sorry,
many,
in every area of life, every part of Judaism, every part of the secular community, everywhere, all the time, unfortunately.
yes, right? This is not an Orthodox problem. This is
Right.
not a Jewish problem. This is a
Right.
human problem,
It's a
and
human problem.
it manifests uniquely in our Jewish institutions, and specifically then in our Orthodox institutions, what it looks like, how we respond. There are very unique elements to this, right? And so if we know the prevalence, and if we're looking at the ACE studies, we're reporting that the ACE studies report the retrospective studies on more than 17,000 adults, asking them, when you were a child, so this person is already an adult, have you experienced any of the following adverse childhood experiences? And 1 in 4 women reported that they had been sexually abused. 1 in 6 men reported that they had been sexually abused. Whether these numbers continue today or are slightly different, the point is we're dealing with a pretty significant prevalence, right? And yet we don't see this coming out. You don't have 20%
Right.
of your congregation standing up and sharing this information, but they're there and they're watching. And so when one lone person comes out and they are shunned, sidelined, totally disparaged publicly, right? They're accused of destroying the community. When all of that is happening, other people are watching, right? And so coming forward, it requires a tremendous amount of courage, as I said before. And then I think that the people who are in a leadership position, I think, you could have a lot of people trying to do the right thing. It's very hard for them to wrap their heads around this idea that somebody they know and trust could have done something this terrible. Each one might say this one thing wrong, and collectively, it results in institutional mishandling of abuse. And so, also we have this concept, right? Like we have this concept in Jewish law, even when you think about the judges, that you can't judge another person if you have a close familial relationship. There are all sorts of like Jewish conflict of interests laws,
Right.
right? And so the same thing is true here, right? Like if you're nogea b'davar, if you
Right.
literally are touching the thing, you can't be adjudicating the same thing. And so when it's your institution and it's your people, you're too close to it. And so everybody should have systems in place. At Sacred Spaces, we have this too, right? Who do you consult with? How do you go outside? And you want that set up in advance, because you don't want to be saying, oh, but I'm different. I will avoid all of the pitfalls that everybody else makes. Or in this case, the policy doesn't apply. As soon as you start saying that, right, you're already going down the wrong path.
I also interviewed Asher Lowy from Zaaka, and he has a line that I constantly re-quoting, which is that sex abuse is Schrodinger's problem, that it simultaneously happens all the time. It's so frequent, like you talked about, and it never happens. When does it never happen? When it's someone you know who's the perpetrator.
Right, exactly. And, it's the first thing that I'll hear is, but this case is different, right? And then they start to list all the reasons why this case is different. Judith Herman, who wrote the seminal textbook, right, on how to be trauma informed and support victims and all of that. She writes that, the textbook cases like, well, the victim shouldn't be believed in this case, and this happened a really long time ago. Why are we overreacting? In any event, can't we move on? This person has a vendetta. This person, has mental health issues. And so that's her textbook. And it's like the first page, she's listing all these things, right? And then every single time you can almost hear the person going through that exact textbook, and they're telling you, this is an anomaly. No, actually, that's a textbook.
They're the first person, whoever said that to you.
Exactly.
But a couple things. First of all, when you gave those statistics on abuse, it's actually much higher in the marginalized communities by multiple numbers. I'm not going through each one. And if a person's thinking, well, here's my institution, here's the person who works in my institution that I know and respect, right? And they have this profile in their mind of this, sleazy pedophile, which is not, true most of the time. Somebody who often appears quite, believable and trustworthy, etc. Right? They're saying, I'm going to believe the person from my institution. Why would I believe the person making the accusation? Because they are in this marginalized group, right?
Right. And often, sometimes the person is like a faceless, nameless person, right? So in protecting their confidentiality and their privacy, nobody knows who they are, but everyone knows who the accused is, right? And so the accused is someone that's beloved, and the unknown is just someone who's kind of messing up the foundation you're standing on. And so that's how it happens. Or if you do know them and that they're from this marginalized group, it gives you something to latch onto if you're having too hard of a time accepting this or believing this. So then you'll latch on to that as an excuse.
Right. I mean, and it is human to have cognitive dissonance. It is human to feel like this cannot be this person. Anybody else I can believe it could happen to, but I can't believe that this person could have done this. And then if you know the person who's making the accusation, right, to distrust them, even sometimes publicly. And this is what I've heard survivors, victims say, that they were more traumatized by the communal response than they were to the actual perpetrator.
Yes, there's this incredible talk by Ruth Krefsky that was recorded by JCW, in which she talks about her experience of being abused. You can find it on YouTube, and I can send you the link.
Yes, please.
It's really powerful, in which I think it's 8 minutes long, in which she talks about and says the abuse itself for her was nothing compared to what happened when the community betrayed her in their response. And we hear this repeatedly. And that's institutional abuse, right?
Right.
That there's the abuse itself, but then how the institution responds can be abusive. And the thing is that so much of the time it's preventable. It doesn't have to be that way.
Right. And then I think when the people have that same cognitive dissonance, they say, okay, innocent until proven guilty.
Right, they're conflating concepts, right? Innocent until proven guilty is a legal construct, and it's not, and that's completely right for removing somebody's civil liberties. But participation in a Jewish institution is not a civil liberty. It's a privilege, and if you've done something to jeopardize the safety of others, then we need to deal with that, right? And there's a different, and this is where policies really start to help people.
Yeah, I want to get into that right next. You're giving me a perfect segue.
I think it could help a person, because none of us want to be in this position of judging another person, and it feels really hard to do, right? So we talked about cognitive dissonance, and we talked about some of those barriers. I think another barrier is attention and values, right? I pride myself on being a person who's done the kafschus, right? Like I judge others favorably, or I work on it. I try at least, right? And that's really important to me, and it's important to not rush to blame somebody else. And so then when you when you juxtapose that with how we're supposed to respond in abuse cases, that can be really hard, right? Because it feels as though I have to go against my natural inclinations or against the very things I've inculcated for so long. And if you'll indulge me for a minute, there's this this Gemara on talking about Gedalia ben Achikam and when he's killed, and this idea that he kept saying, like, I don't want to hear it. You're telling me that somebody's coming to kill me. I'm not listening because it's Lashon Hara. I can't hear this. And he's held to task for it, right? And when in talking about all the people that are killed, it says that Gedalia that he smote, right? And like, no, but Gedalia didn't kill those people. But he didn't take action and he didn't respond. And so it's as if like he had some responsibility there. And this idea of chashdehu, suspect a person, vikibdehu, and to also respect them. And so when we get to our policies, I think what this allows us to do is to not have to jump to judgment and say like, I am calling this person an abuser, or I'm going to label this person, but instead it gives you license to take action a lot sooner simply because you have a policy violation. And so the same way, like if you have a tardiness policy and your teacher comes late to class, this can be the very best teacher in the entire school. But if they're missing 30 minutes out of a 45-minute session, right? Like they can't continue in that position. And when you let them go, you're not letting them go and telling everyone they are a terrible teacher, right? You're letting them go because they violated your tardiness policy. And I think the same thing can sort of happen here, which is if we move away from this place of like, what's the bare minimum of like, don't be an abuser or don't abuse, and instead move to this place of modeling safe behavior, then when somebody is not a champion of youth safeguarding or other safeguarding policies, when somebody is not modeling safe behavior themselves, then or they're violating a policy, then we can address that very early on without having to categorize them as an abuser, but it just gives us license to move.
Right. And I think it just has to be said that it's not your job to be judge and jury. It's your job to keep the people in your institution safe.
Yes, it is your job, though, to have due process built into your institution. Right.
Because but that's not the same thing as saying I have decided who to believe.
Exactly.
That's what I just want to make a point to that, because I think people get all caught up in, well, I have to take sides. No, you don't. You should not.
In fact, you shouldn't, right? If you're not there,
you should not. You should not. And then it's not a conflict, really. It's not a conflict. So I really want to go through your policies. It's on your website. There was an article on your website from April of 2016, I believe. 10 policies.
Yeah.
Do you have them in front of you?
I don't have
the 10 policies. I listed them. So the first one I have is, I'm on top of this, don't worry. The first one I have is adopt child protection policies proactively.
Exactly. Yeah, so that one's really important. We don't want it to be like this thing you put in place afterwards to manage liability, right? Because abuse can be prevented. And so if you start having the conversations before you have a real problem, you can start to think through some of this, and you can have practices in place. And then when things get really muddy because it's somebody that you can also just have a clear policy with a clear plan of action. And so what you should be doing in that moment is pulling out your policy and saying, what are the steps outlined? What are we going to do? And so, your policies can be both preventative and responsive.
Right, and this is something that a school or institution could work with you to develop over time, and they'd have to get on that wait list because that's really intensive, right?
Yeah, and also
or they could just model it based on what you have
right.
there, or use somebody else.
Look, some of these things are starting to become standardized at this point.
Mm-hmm.
CDC has a really good guide. Our Aleinu.
So you cut out a little bit. Who has a really good guide?
The CDC, the Centers for Disease Control.
Okay.
They're in the process of updating it, but their old guide is still really good. Mm-hmm. You can go on to our Aleinu website, and if you participate in the program, you get access to all of the materials. So yes, you can go through the process, and also like in some respects, it just gets started on the basics. But what I would say is that what you don't want is some legalistic policy, right? That's
right,
not
just to protect yourself. You're not trying to just protect the institution. That would defeat the purpose.
Right. And often we see policies that look like that, right? If your policy is saying something like report abuse to the attorney, that's not protecting youth, right? Because reporting to the attorney or your general counsel who's not trained in youth protection, but does have privilege in the institution, is not consistent with the law, which says report reasonable suspicions to the authorities.
Right.
Or if you really wanted to know or to get some expert advice, then you should be calling a child protection professional if it's a child case or somebody who specializes in elder abuse.
Right. Or a non-disclose agreement that you have your employees sign.
That's right. And that would be an example of something that many organizations don't even realize that they have, right? They're getting some boilerplate contract from their attorneys, and they look it over, they're grateful for the pro bono support, and they say, great, we're going to use this. And then what turns out is that actually there's a clause in there saying that you're not allowed to talk about any of these things. And essentially what you're doing is silencing people.
Right. Right. Okay. Number 2 I have here is model safe interactions with children by adults. I love that one. Oh, and I want to put in a plug for Rachel Bayar, who I've interviewed. She has the Bayar group, Bayar, and you can also work with her on making safe institutions. So she's another resource.
Yeah. So, I think what we want to flip here on this model safe interactions is that we're really focusing not on here are all the don't do's, but here's the way in which you can do. And if people can start to see this is what safety looks like, and I think this is across the lifespan as well. This is what a respectful interaction looks like. This is when I respect that another person has the right to agency, bodily autonomy, their own ideas and opinions, right? It's the difference between controlling another human being for your own benefit and respecting them as their own entity. And so that's what I mean when I say model safe behavior. And this is a group of doctors, right? So
This is for lay people. This is for doctors. This is for therapists. This is for everybody.
I had a doctor story. I would tell if it was.
You can tell a doctor story still. We share.
Great. So so I remember when I think about modeling safe behavior and when does that start? I remember so clearly in my mind bringing my 3-day-old home from the hospital to the pediatrician's office. Like we didn't even stop home. We went straight there, right? It was time for the visit. And I remember the pediatrician, his name was Dr. Gary Egel. And he, I handed the baby to him or tried to hand the baby to him so he can do his exam. And he looked at me and he said, would it be okay if I got to know your baby first? And I said, sure. The baby's 3 days old, but sure. And so then the doctor started to talk to my baby, coo at the baby, make eye contact with the baby, and gently touch the baby's hand. And then turned to me, the parent, and said, would it be okay if I take your baby now? And I said, yes. And then sort of after receiving my consent and the baby's consent to the extent that the baby could,
oh my
took the
gosh.
baby. And then during the exam, my baby started to cry. The doctor stopped the exam and said, Mom, your baby wants you right now. Backed off until I had calmed the baby down. And then proceeded the whole thing again to coo at the baby, look at the baby before touching the baby, so that in a way that was developmentally appropriate, the doctor was communicating the importance of receiving the baby's consent to the extent that the baby could consent. And that stayed with me forever. That people are always saying, when do we start to talk to our kids about these issues? And the answer is from the day they're born, right?
Wow. Oh, that is so beautiful. Very unfortunate. I always whine about how much time I have. This is a long time ago. It takes more time. It's as doctors, as pediatricians, I think that's hard to hear. It's so beautiful though. But I mean, I think it is important for pediatricians, by the way, to model stuff like this. Maybe with a newborn, I mean, that's exceptional, but with very, very young children. I know when I do an exam of the child's private parts, I make a big deal to the parent, even at the youngest child. Do I have your permission? Do I have the child's permission as soon as they're old enough to consent? And I think that is something that should be standard.
Right. And in our institutions, like, yes, that example is like an exceptional one, right?
Yes.
But I think
I think
there are so many ways in which we can do this quickly, right? So I even think just about all the times in which we grab children, right? Like even for a good thing, like, oh, you got to see this bird outside the window, and then we grab a child's body, right? But if teachers are understanding, if everybody is understanding that we're not grabbing children's bodies for our own means, but instead we're communicating to them like, hey, come look, and then the child might come slower, right? But just this is what I'm talking about when I say model safe behavior. And some of these are maybe beautiful extremes, but in every way, if I'm at a Shabbos meal and a child says, hey, Shira, come see my room, right? I'm not leaving that Shabbos table and going to the bedroom with the child.
Right.
Not because I'm going to abuse the child, but because I'm not modeling safe behavior.
Exactly.
And so I'm not going to make a big deal about it and be like, oh no, I can't come to your room and turn this into a scary thing. Instead, I'm just going to say something like, check with the parents, like, hey, she wants to show me your room. Is that okay? Parents are like, yeah. Then I might say, like, who else wants to come with me? Right. And so it doesn't have to be every time we model safe behavior, it takes so much time or we turn this into a scary thing, but we can just in everyday interactions start showing youth, this is what a safe adult looks like.
I love that. And I also love that you keep emphasizing not to scare, because I think that everybody's terrified. And if you communicate that terror to your children, you're undermining what you really want, which is them to feel that I can tell you anything.
I
Right.
think that's true.
Or that, you keep emphasizing all the principles, not just preventing sex abuse, but consent, bodily autonomy and stuff like that. You don't want to scare them. You want to model it in a child-friendly, right, developmentally appropriate way.
Exactly. And you don't know when or where a child might need to disclose something. So this becomes hard, right? Like, because if you say to a child, you can tell me anything, but then like children come and tell you things and then they keep getting yelled at for the things they're telling you, right? So how do you navigate the fact that there are going to be rules and consequences for various things? You have to navigate that, right? Like you have to start every disclosure that a child says to you with like, thank you for telling me. And I remember the time my kid broke the lamp in my living room and came and said like, I broke the lamp. And I'm thinking, oh my gosh, how many times did I tell you not to climb on that lamp, right? Forget about
Thank
the
you
fact
for
that
telling me that.
right now, that doesn't mean that we're not going to have another conversation, but I can't have a first reaction of yelling, right? Or
Right.
of being really upset, because then immediately what happens is that the child internalizes that. And the next time the child has to tell something, and abuse, often a child can feel like they're complicit or they're doing something wrong, right? Because they understand some concept of privacy, or this isn't right, this isn't normal, what usually happens, but they don't understand that who's at fault or what happened. And then when they're trying to tell, they may experience tremendous shame, or maybe even the person who's abused them has really sent that message. And so I'm not saying it's easy, and I'm not saying I always get this right myself, but just sort of thinking through all these messages of what these safe interactions look like. There are opportunities every single day. And when you're talking about not scaring youth, I'd say that I wish we could like sort of get this message out across the board. It's not just about children, right? It's what if like addressing abuse was about, in our Jewish communal institutions, was about, or families or anywhere, was about offering more support to everyone involved. And so that means support to a victim or their family when they come forward, right? Not like, oh no, you're trying to destroy everything, but instead, how can we support you? What if it was about offering support to the institutions? So instead of us, like, and they have to be held accountable, but also, do you need support in dealing
It's
with it?
hard. It's emotionally
Yeah,
devastating.
it's emotionally devastating. Can we support them in supporting victims? Can we support them in responding correctly? What if the people who are causing the harm, the people who may abuse themselves, what if there were support for them in not abusing? So that if someone feels that they have certain feelings or thoughts that are confusing to them, or maybe they know are not right, that they have someone to go to, that they know who they can talk to, and that they can
That, by
gain.
the way, is the final frontier, right? I mean, people decide either I'm not going to believe you and you're innocent, or you are, evil and you are completely shunned.
Right. And what if
We're not
instead,
going to go down that. I can't go down that rabbit hole, but also there are false accusations, and that was also devastating.
I think that we know that the percentage of false
It's
accusations
small,
are very,
right?
very small. Although in any case,
Hmm.
people will always tell you, but this case is a false accusation, right? And then of course how do you know? Oh, the person told me, I didn't do it, right? So look,
But it does happen, and it can be
but
very devastating.
it does happen. And the best way to account for that is to have your systems in place, which is why when we were talking earlier, I talked about the importance of due process, right? And so if you have your system in place, then you go through it. You're not making rushes to judgment in any direction. You're just, when you receive information, thank you for telling me. this will now initiate a process that we will go through. And that process includes making sure that the individual who is accused, that there is a system in place to look into it fairly.
Right, I want to go back just for just a minute because we mentioned the potential perpetrator who may have actually done something, and I don't want to be we're not necessarily talking about pedophiles, and I think that people think of either you did it and you're a pedophile, or you didn't, and I think that there's a lot of different inappropriate things that happen, particularly when they're teenagers who just are impulsive or they just don't know themselves, and they do deserve help. I'm not saying who does and who doesn't. I'm just saying that I just want to get clear that there shouldn't be a dichotomy in people's minds.
Right. Well, first of all, the term pedophilia is a clinical diagnosis,
Right.
and people who sexually offend against youth may be a pedophile, and people who are pedophiles may not sexually offend against youth.
Right.
It refers to a sexual attraction, but not to
Right.
the offending behavior. What we know from research is that quite a number of people who are not pedophiles and who are engaged in adult relationships, romantic or sexual, also sexually abuse children, and that some of these are opportunistic. And as you talked about, there is a range of behaviors. We can often see an on-ramp for a whole range of harmful behaviors before we get to that point. And so we have a lot of opportunities to intervene, but we're so focused on that extreme example of egregious abuse that we miss all these opportunities. And instead, we're thinking about the offender who is out there, as opposed to thinking about the fact that actually quite a lot of people can cause harm or receive harm. And how do we start thinking about this holistically? So to broaden beyond sexual abuse for a moment, one yeshiva that I know of at the start of the pandemic, as they were hearing parents saying, the schools were closing down and parents still have to work, and parents were saying, I'm stressed beyond my capacity at this moment. I'm hitting my children. I never hit my children before. I'm yelling. I'm not the parent I want to be. One yeshiva put out a YouTube video from their mental health team and said, parents, we see you and we want to offer support to you.
Oh, wow.
And reach out so we can help you, so we can provide some respite. And so that kind of approach, that meant that yeshiva was understanding this is an on-ramp towards abusive behavior, right? Are these bad parents? No. Could this easily lead to an abusive situation? This sort of terrible configuration of all these stresses? Yes. And so they chose to prevent it by offering support. So,
which is amazing. And they're also saying this is something you can talk about with us.
And that was the response that they got, was families saying, and it was directed to the parents. It said, hey, hi parents.
We see you. Wow.
2 minutes. It took them, it was a 2-minute video, but they sent a message to their community. We are not silent on abuse, and abuse is not other people. Abuse can happen in all of our homes. So let's start talking about it.
That is amazing. Okay, I'm going to go back to our list. Number 3 is have a clear policy with a clear plan of action. I mean, that's pretty clear. Do you want to talk about that more or go on to more things? Because there's a list of a lot. So there were 10. We're only up to 3.
You can keep going.
Okay, keep going. Okay, because people can also go back to the website. Again, jewishsacredspaces.org. Consult with child protection experts. One size does not fit all institutions. I think that maybe need to talk a little bit about, because again, even if you read your resources, even if you've done your program in a real life situation, right, you may need to bring in expertise.
You do need to bring in expertise.
You do, sorry.
Yeah, no, it's just, if it were my case and it involved people I knew, even though this is the work I do every single day, I would bring in an outside professional to guide me, because I'm too close to this. And because I'm dealing with really sensitive potentially life and death situations. So I need outside advice, and it behooves me to check, even if I think I've got this totally right. I would bring in an outside consultant and say, here are the facts. Here's what we've done, or here's what we're planning on doing. What have I missed? Can you give me any guidance? That is just so crucial. And it really requires some humility. It requires saying, I don't know everything.
Right.
And I want to make sure I do. But instead, what we tend to see is that if an institution is calling an expert, the expert they're calling is their attorney. And you have to remember that an attorney, particularly a general counsel, their responsibility is to protect the institution. And so they're coming with a very particular lens. And an attorney can be really helpful to the institution, and should be a part of the conversation. But an attorney is not a specialist in abuse, unless that's their specialty, right? But then they're not your attorney. And so, often we'll say to institutions, bring your attorney along, or let's have a conversation with your attorney, because if your attorney is giving you conflicting advice, we want to hear what your attorney's concerns are, and then we can work it through together. But bringing in a professional who specializes in victim support, a professional who specializes in understanding safety and risk assessment, right? Like any of those people, they're going to give you a different lens, and that's the lens you need right now if you have a case that comes forward. And what you don't want to do is to be hearing a case and saying something like, yeah, we looked at it, we listened, and we decided that this didn't rise to the level, or there is nothing here, right? Because if you're not trained to identify all the different dynamics and early indicators, you might miss things. If you don't know what grooming looks like, grooming is a series of seemingly innocent behaviors, but that are towards an ultimate end that is abusive. If you're not trained to identify these things, then you would miss it. And so the same way you wouldn't like try to diagnose and treat a medical problem on your own, these are cases that just need professional support.
Right. There's another aspect, though, and that's that you are not objective if you bring in your own people as opposed to an outside expert. And I think that that's something people need to pay attention to if it's happening in their own institution and they say, we looked into it, who looked into it? I mean, this is about getting an outside evaluator, first of all, with the proper expertise, but also transparency and accountability.
That's right, right? So what we would want to see an institution do, sometimes they say like, let us know if you have information, right? And so that sounds like a good thing, except the question is, who's the let us know? Is it that everything has to come back to the institution, but the institution themselves is being accused of wrongdoing? Or are they saying, actually, here are numbers to call. Here is the number to the detective on this case. Here is the number to an outside investigator. And you can contact someone in the institution, so that people have multiple pathways to sharing information. So I think that's getting at some of what you're talking about. The other thing I would say is like, there are two different groups of people, right? So you need to have an internal case handling team. And on that team, you definitely want to look internally within your community. Who in your community has expertise? So if you have experts in-house, if you have parents in your community, if you have board members, bring them on board. Mental health professionals, attorneys, absolutely. Everybody should be comprising that pool. And from that pool, you create a committee that is prepared to handle cases. And that then you also need outside experts, and you need both. You can't have one or the other, because you need a group of people internally who are managing this. You never want it to be one person, because that's how things end up being mishandled or covered up. And it needs to be someone external as well.
Right, that's really, really important. Okay, I have a separate list of best practices that I think are more for prevention. Oh wait, there's 10 more of these. Oh my gosh, I don't even get to all of them. I'll just try to maybe focus on a couple, and people can go to the website. But it's really, really excellent, and it's really, really detailed, and it's really important. I like the one on develop protocols for responding. I think we've talked about this, but I don't know if you want to add any more to that.
No, I think we've talked about it.
Okay.
I mean, I think, we could summarize all of these into like sort of the 3 or 4 core areas if you wanted to keep it really clear for listeners.
Keep it simple. Yes.
Yes. Okay. So I think we did 2 already. So one is consult with the experts. You always want someone outside. The second is you're developing your protocols, and those protocols can be both and policies. That's preventative and the response, as you just mentioned. So those are 2. The other 2 I would say is one and I just sort of referenced it a little bit. So you want a committee in place to be addressing this issue even well before you have a problem. What you don't want is for this to be a one-time initiative. Like, you're going to bring in someone to do this wonderful training, and then it's all over. Instead, you want this to be an ongoing priority for your institution. And so having a standing committee in place can help with that. And so, so that's a really important one. And when I kind of, at some point I looked back through our work, and I wanted to look at not just when do institutions get it wrong, but what are the institutions doing when they get it right? Like, could I pull out some of who I think are like our stars who have been like really responding really well? Are there any patterns that are happening across these institutions that are responding so strongly? And one of the things that I found was that each of these institutions had a champion. They had somebody who was not going to sleep at night until they move things forward on this issue. And because of that, one person was often impacting hundreds, thousands. In one place, I saw one individual change the lives of tens of thousands of people.
Wow.
And so this committee could be that champion. But essentially, you're putting together a group that's saying, we're going to just like tackle this in a steady pace, right? Like in a steady pace, we're going to kind of look at what the risks are in our institutions. We're going to put some prevention practices in place. We're going to annually review this, right? So that this doesn't have to be this frenzied, overwhelming thing, but that every year your committee is moving this forward and that this remains an ongoing priority for the institution. And then the last thing I'd say is that you're talking about these issues, and that needs to be baked into the culture. That this is not like the secret or it's like the special one-time event that we do during the year, but that it's ongoing education throughout the year with all the parties involved. And that can be in really small ways, right? Like it doesn't mean that all we ever do in this institution is talk about abuse prevention. It could be as simple as every time you send out a flyer, at the bottom, you put a link to your youth safeguarding policy. Or it could be that every time you host an event, you stand up and you say, I just want to remind everyone that this is the safety officer at this event. And if you have any concerns, please approach them. And we're here to help you feel safe, right? Like small, simple things like that start to bake it into the culture that we're keeping an eye out, that it doesn't matter how wonderful our Jewish programming is if people aren't safe in our institution.
I think that's amazing. And I'm glad that you brought it down from the 9 billion things I had on my list, number one. Number two, I keep thinking about it from the parents' perspective because a lot of my listeners are parents. And I love that you said one person was behind so much of the, best practices schools and institutions. So people who listen can say, hey, I can make a difference. I think that's really, really important.
I think about this one pediatrician that I know who learned about this issue, attended a talk, and was forever changed and said, I can't put this issue down. I'm a pediatrician. My life's work is about helping children. And this is going on in our own backyards, in my own community, and didn't put the issue down and continued and has systematically gone through all of their institutions, the schools, the synagogues, the camps. This is like a person who's very involved and a leader in the community and was sitting on multiple boards, and every institution that this person touched, this person said, we're going to begin an initiative, and not like a quick one-off initiative, stuck with it for years on end. And all of these institutions now have systems in place to both prevent and respond. And so this one person has impacted thousands of people.
That's incredible. But even for a regular mom, or dad listening to this, right? I don't want to make it so broad that like they're overwhelmed. You can go to your school or your shul and say, hey, what are your practices? Did you know this organization? Do you know that we can do this? And also for everybody to just keep pushing for that, transparency. What are the policies? Do you know what they are?
And that matters, right? Like we will get calls from schools or camps saying like parents are asking for this, right?
Right.
Your institutions want to serve you well. And if they know that something matters to you, then it's going to matter to them. And I'd say that you can ask this question in a supportive way. So what you're not doing is calling up the institution and saying to them, where are you on this issue, right? But instead you're calling up the institution and saying, this is a really important issue to me. I wonder if we have any of these things in place. And if we don't, how can I get involved to support you in doing this? I know it's a big effort. I'd love to participate. So that doesn't mean you're taking on the whole initiative, but you can do one piece. And from parents coming forward to support the school and together partner in preventing abuse is this really positive thing. And that can make a huge difference. And so you're right. It's really a matter of one email, one phone call. Everybody starts to do it. And we have overnight, you can have an entirely different culture.
Right. And I think that is very empowering for parents who might be feeling it's all on their shoulders and feeling overwhelmed. And it's amazing the work that you do. It is unbelievable. So I want to thank you so much. Unless there's something else you want to add, this was amazing.
Thank you so much for having me here today. I want to tell people, don't be overwhelmed. And you don't need to be scared, right? Like being scared doesn't make safer spaces. But I do want to say that a lot of the abuse is preventable. And so if each of us does one thing, makes one practice a little safer, or just ourselves begins to model safe behavior, is a safe space for a child to come forward, to listen, is there for other adults, right? This is not just children. We focused a lot on that here today, but really is modeling what that looks like and is not afraid to talk about this and to support our institutions. I think that together we can make a difference. And so, Dr. Quinn, thank you for having me here.
Thank you so, so much.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at JOMA_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.